thank you both Jared and Lenka for those really fantastic presentations and for already getting the ball rolling for the next phase of our forum today, which is really to discuss some issues that have arisen. And so that's why for those of you who received the pre-survey that we sent out, we were asking what things would you like to discuss, and we're just going to literally pick up from where we left off in our spring forum because we ran out of time for our topics. And so for those of you who were here the last time, we introduced a Google Jamboard, and we can go ahead, I can drop that into the chat, and then we'll share screen, but we invite you to share that to on your computer, share responses. And we'll just kind of do this starting with topic number 3, which was from the previous forum. So these yellow sticky notes you see here are responses from the previous forum. So we ask if you're going to respond not to use yellow so we can differentiate from those that are previously shared to those that are shared today. And so the first topic that we had run out of time to discuss last time was talking about equating values to a determined serving of fruits and vegetables. And so this was a commonly requested topic. And then we have some other additional topics to discuss. And so feel free to unmute and share or add content to the Jamboard, whichever you'd prefer.
And if no one wants to jump in, I hate to call her to the table, but Stephanie is working on, I think you even just published a paper that looked at some of this. Forgive me if I'm misspeaking, but you're working on some of this, correct?
Mm-hmm.
Okay.
Yeah, we had the juice study. And yeah, it's under review. I can try to see if there's anything I could share from that. But yeah, it's under review right now. And some of the reviewers are kind of, because we used a juice as a proxy for vegetable consumption, and some of the reviewers have kind of taken issue with that. And so maybe somebody else wants to write an R01 where they actually feed people vegetables, actual vegetables, instead of a juice.
Wait, so can I ask you a question to clarify, Stephanie?
Sure.
Or actually, this might not be a clarifying question, but isn't Lisa's paper like the first paper? Yeah. Wasn't that with juice as well?
No, hers is with actual vegetables. She had 28 participants and she gave them boxes of vegetables.
That's right.
The only issue with hers is she didn't use the veggie meter. She used, I believe it was a hand-built RRS that Werner built himself.
Yeah. Yeah, we used that one in our first study. Yeah, that's right. She did use vegetables, but she has published a juice study, so I'm surprised that there's.
I don't know if she ended up publishing her juice study. She had a juice study that was going on, and I've seen results of it, but I don't know that it ever got published. It might have gotten published like maybe she presented at ASN or something. It might have gotten published in one of those things.
That might be what I'm remembering. And
I can try to look real quick and see.
Excuse me. I'm just curious if anyone else has any experience with having like really detailed dietary information and veggie meter, and if there's any thoughts on this, just because I know this was one of the goals really of sort of creating this collaborative, was to say, will we be able to determine specific serving sizes if we know certain criteria, from each participant. And so I'm just curious, where we are half a year later.
So this is Lou Rubin at Georgetown in DC. So on one project, we're generating some of those data. Very preliminary ones were presented in a poster, I think, at ASN last year. So this is a project dealing with families which include small children. So we have it's longitudinal for adults and kids, especially children from ages 1 through 5. It actually started pre-COVID, but it's a food and meals provision project and implementation research for families who have housing insecurity, food insecurity, et cetera, et cetera. So we have longitudinal measurements. So we have at least 2 Veggie meter measurements for each subject, kids, adults. At approximately those same times, the dietary recalls are using the ASA 24. So from that, we have HEI data, not yet analyzed, but dietary inflammatory index. And we, with one of our, the RDs who's involved in the project, we kind of created, not kind of, we created a series of thematic subscores from the ASA 24, one essentially on brain health, one on high carotenoid intakes, just as examples. So we have cross-sectional and longitudinal data where we're looking at dietary intakes based on the ways I've described, and contemporaneous Veggie meter scores. There are a bunch of other outcomes, but they're not particularly related to this. And I can tell you that from the preliminary look, there's a bit of a dietary improvement, but in general, the scores are, shocker, really low. But the aim, one of the aims was actually, I was brought into it more from the nutrition side and suggested the Veggie meters, were able to buy one for that project. But the idea was to try and get a better handle on dietary intake and Veggie meter scores, as well as other non-invasive. There's another project that's just ramping up right now, which is a look at breast milk content over time, obviously lactating women, and that uses again serial ASA 24 assessments and serial Veggie meter assessments. No data,
Yeah.
or not much to report here yet.
Okay, well, we'll be.
But I think
tapping you
other
to
people are doing
present
similar
soon.
things. Sorry, Rachel.
Oh, I was just saying, when you're ready, we'll be tapping you to present and share your findings with us. So keep us posted. I mean, I think, are there others who are doing this detailed dietary recall information alongside? I know the point of the Veggie meter is to hopefully limit the amount of detailed dietary information we're collecting, but I'm curious to know if anyone's using these tools.
Rachel, this is Albin from the University at Buffalo. We are doing diet recalls. We're doing so our studies of baseline and follow-up, trying to understand if the Veggie van has an impact on diet and consumption of more fruits and vegetables. But we are asking participants at both baseline and follow-up for a weekday and a weekend diet recall. So in total, if they complete all 4, they would have 2 at baseline and 2 at follow-up. We're doing a 24-hour recall, so trying to get a sense of what participants had to eat the day before, and ideally 1 during the weekday and 1 during the weekend. So for us, we treat calling on a Monday as a weekend, since we're asking for the previous day, that Sunday. And we're currently analyzing our data, so we don't have a lot of findings to report. But we do see that, there is a lot of data in there, right? So for us, we're very interested, our director and PI is very interested in just getting a sense of the vegetable consumption. So currently, just to share, we did see that, vegetable self-reported consumption from the diet recall did go down, which kind of matches what we found on our Veggie meter data or our self-reported data as well. The one thing is that, you know, we are looking at some other variables to try to help back that up. So getting diving into a little bit deeper into some of those variables and understanding what's there. And I remember someone was talking about a validation study so for us, we're already thinking about a validation study in terms of, you know, participants that have diet recalls, both diet recalls, and participants that have veggie meter reading, so we can understand the beta and alpha carotenes that are found in that or reported in the diet recalls, if they are, you know, if they correlate with the veggie meter readings that we get from participants at both baseline and follow-up. That's currently where we are. We're hoping to have something by January in terms of reporting out on more of our diet recall data. And, you know, ideally, you know, we can definitely share that as well. One thing I did pick up here is that, you know, we can go to someone for help on geocoding. So that's something that we may reach out for. But again, in terms of sharing our findings, when you know, that validation of diet recall and veggie meter reading comes out, we'd be more than happy to share.
So I see two hands up. I see both Susan and Marcella. Marcella, were you going to oh, can everyone hear me? My internet connection is unstable. Okay. Marcella, were you going to share the findings of the paper we just submitted? I'm curious because it made me think of that.
Yeah, a bit. Sorry for my camera being off. I'm actually participating in a nutrition research study today. So reporting from UC Davis, but we just submitted a paper last week. It doesn't necessarily look at specific number of servings, unfortunately. We validated a novel dietary assessment tool with the Veggie Meter, as well as blood carotenoids and NDSR dietary recalls at 2 different time points. So the repeated 3 24-hour recalls pre and post. And it was an observational study, but looking at the usage of food access resources in a population of individuals that matched similar demographics to food insecurity rates amongst college students. So hopefully we'll be able to share that with you all very soon. It's under review at the moment. But I think one of the big things to bring up is not just looking at you know, general fruit and vegetable intake, but also looking at a specific number of servings, because I know that's been something that we kind of are able to tell amount increases, not specifically numerically. But I think one of the big things that I'm hoping to see with the Veggie Meter as the research goes on is how can we equate carotenoid rich foods in a particular number of servings as the score increases over time with different interventions or dietary intakes.
Thanks, Marcella. Susan, you've had your hand up. I see Linka and Lou also have their hands up, so we'll get to you both next.
Hi, yeah. So I'm collaborating on this project. It is an intervention where we're providing food boxes, and we'll be collecting the ASA 24 as well as Veggie Meter scores in about 200 individuals, 200 adults. So they will have had 4 months of food boxes with fresh produce. And so that is set to start in July. So recruitment is beginning in January in this project, and it's in a rural First Americans community here in Oklahoma. So that is, you know, kind of along the lines of looking at the dietary intake with the Veggie Meter score, in addition to a less studied community and population, because as somebody had mentioned at some point, most of the work has been in non-minority settings. Are we doing box weights? No, we're not weighing the boxes. So, but the food that will be in the boxes will be about 60 servings of fruits and vegetables for a family of 4 for a week. So that would be like 5 per day for the people in the family.